Hello, and welcome to episode number 2 of The Breakdown with Dr. Mooney. If you haven't already, go ahead and hit subscribe. My name is Dr. Mooney, and I'm a board certified family medicine physician who is passionate about primary care and educating the community. This improves healthcare outcomes for everyone. In my first video, I talked a little bit about how the healthcare system is collapsing, and today we're going to discover a little bit more about why I believe that's the case. I really want to educate you guys about healthcare deserts. You may have heard of a food desert, but a healthcare desert is a new concept that is affecting millions of Americans today. It is estimated that more than 81% of counties in the United States of America are healthcare deserts. This affects more than 120 million of us, and many don't even know that this is happening. What is a healthcare desert, you ask? Well, the experts are still working on what that official definition means, but essentially, a healthcare desert is an area where there is lack of access to a full spectrum of healthcare necessities. This includes primary care offices, pharmacists, pharmacies, trauma services, and staffed hospitals with beds available to take care of patients in need. A large percentage of the country has no access to a full range of health care necessities. Now, you may be thinking, I live in a big city. I live in New York. I live in Chicago. I live in Cleveland. This doesn't affect me. I don't live in a healthcare desert. Well, you're wrong. We're all interconnected, and this affects everybody. For example, let's say you love the outdoors and your New Year's resolution was to go hiking and spend more time in nature. However, in a national park, you trip, you fall, you break your leg, but there's no hospital for 2 hours from where you are right now. What happens then? Or let's say you live in Cleveland or Chicago and you decide that you're going to drive to New York City to go sightseeing with your parents. However, somewhere along the Pennsylvania Turnpike, your father has a heart attack, but there's no hospitals available for at least 60 miles. Then what? What if you're on your way to a work retreat, just an hour or so away from your hometown, and you unexpectedly go into early labor, but there are no OBs available in that county? Let's say that your child has an asthma attack in your hometown. You don't have an inhaler at home, so you rush to your local hospital expecting for your child to be seen immediately. However, there's been a calamity in the county over, and all of their patients are being diverted to your hospital. Now the wait time has increased for your local emergency room, and your child cannot get the care that they need at the time that they need it. For these reasons, I say that our healthcare system is completely interconnected. If somebody is lacking healthcare in one area, it will affect us in another area. The National Center for Work Health Force Analysis estimates that there will be a physician shortage of 140,000 physicians by 2038. 30 out of 35 registered physician specialties are expected to be in extreme shortage by 2038. That's just around the corner, guys. What can we do about this? Let's be clear. The fact that this is happening in our country, which is one of the wealthiest in the world, is completely policy driven. Our government needs to act quickly to increase the amount of residency positions available to train doctors. We also have thousands upon thousands of fully qualified doctors that were practicing abroad but have no pathway to practice medicine in the United States. There should be no reason that somebody who's been educated, fully vetted, and has no record overseas should not be able to continue practicing medicine here. We also need to find ways to decrease the financial burden that it takes to train a doctor so that more people like myself will find the ways to be able to train in primary care. These are very real strategies for decreasing the healthcare deserts, but these are years into the future. What can you do for your community right now in order to improve healthcare outcomes and keep your neighbors healthy? At the risk of sounding like a broken record, I say that the solution is education. Educate yourself about basic first aid and what to do if there's a medical emergency on your watch. Every American should learn how to do CPR so you can at least get the process started if somebody you know or love is having a cardiac event. Everyone should look up videos or seek training about basic wound care and what you can potentially do to assist if labor happens when there are no doctors around. Preventative care is going to be life saving. This starts with living a healthier lifestyle, choosing fruits and vegetables, drinking more water, avoiding alcohol and smoking, getting active, getting outside, and decreasing your risk factors for chronic disease. Also, this involves establishing care with a primary physician. Even though you may have to drive 2 hours, you may have to wait 6 months, you may have to save up a few months of pay to be able to see that primary care doctor, I promise you that as primary care doctors, our goal is to keep you healthy and out of the hospital. If you know that you live in a healthcare desert where you won't be able to get emergency services, your top priority should be making sure you are healthy enough to stay out of that emergency room. In the next episode, I'm going to be breaking down the process of even finding a primary care doctor, what you should be looking for, what you can expect, and how to prioritize and optimize that little amount of time that you have with the specialist in front of you. If you have been a victim of healthcare deserts, I would love to hear your story. If you have an interesting tale of what's happened to you when there was no doctors around, please leave a comment down below. If you haven't already, go ahead and hit subscribe. Until the next time.